Hi guys, so today I'm going to be talking about what to expect after thyroid surgery. So I've already filmed a video about what to expect before, during and immediately afterwards. I've linked that one here. And then today we're going to be talking about what to expect when you wake up to about 6 months post-op. So starting from waking up, you might be wondering about pain because that was something I was concerned about, but actually I found that the main incision site didn't hurt at all, and actually it was very numb. So I spoke to the surgeon about this and he said that's completely normal. You experience a small amount of temporary nerve damage and it just means that that area is numb and you don't experience pain there. And so if, like me, you were probably wondering what that was going to be like, actually there's no pain at all. So even though having a big cut like that may be something you haven't experienced before, it actually doesn't hurt at all. So I hope you'll be reassured by that, and don't be worried about the temporary nerve damage either, because that all heals in a couple of weeks to a couple of months, and that is completely normal. One thing I did experience was a sore throat, and I don't mean on the outside, I mean on the inside, like how you'd experience it with a cold. This is because you're intubated and that alone can give you a sore throat, but especially with a thyroid surgery, you've got a tube on the inside, you've got them cutting on the outside, and it can cause a little bit of irritation there. But just your standard cough sweets or throat sweets will really help with that, and so I was really pleased I had these. And then the other thing that may be slightly uncomfortable is that they often put a drain in, and from watching other people's videos I've seen that everybody had the same experience. The actual incision was fine, but the drain can be a little bit bothersome if you don't keep an eye on it. So when they place the drain, it should look like this, where it's just going directly into my neck and the skin on my neck isn't affected. But when you're sleeping and possibly rolling around in the night, it does have the potential to get tugged. And so if you look at this picture, you can see that it's tugging on my skin a bit. That was quite uncomfortable until the nurse retaped it. And so if you're having any discomfort in the beginning, I would just get your phone out, just have a look in your camera and see, is that drain being tugged? Because most likely it's just a simple case of retaping it so that it's more comfortable and not pulling on you, and then that should help. Then moving on to your first night, you will likely be brought back to the ward in a bed, and that will hopefully already be in a good position for you. So mine was at an angle like this, so instead of being flat or completely upright, it was just at an angle, and I found that really comfortable. I didn't have to adjust it, but the perk of staying in hospital is that you do have that remote, and so you can adjust the bed to be however you like it. Some people find it most helpful to sleep on their back, especially if they've had a complete thyroidectomy, or if they've had a partial one, they will sleep on one side. However, that's not what I did. It takes me a long time to fall asleep, and I often toss and turn, and I still did that, and I wasn't affected by it. I did roll up a t-shirt and put that in the crook of my neck, and that gave me some support if I was sleeping on the side that the incision was on. But really, I didn't find the first night uncomfortable, and I wouldn't say it's anything to worry about. And then after you've hopefully had a good night's sleep, you'll wake up, and this is often when they will remove that drain. So when they did this for me, I didn't know what to expect, and I was mainly concerned about pain, but it wasn't painful, so that was really good. But what I didn't know was that there would be this huge release feeling, and the release to me felt wet, and I really thought there was blood everywhere. And I was talking to the nurse, she pulled the tube out, I felt this like whoosh, that's the best way I can describe it, and I just instantly went quiet because I thought there was blood on my pyjamas, and I thought the nurse was going to have to clean it up, and I thought, oh, I'll just stay quiet while she deals with this. And then she was like, oh, are you okay? And I was like, yeah, I'm fine, but is there blood everywhere? And she was like, no. And then she showed me the dressing thing that she was holding. Not a single drop of blood. I'm not sure if everyone experiences that, but I was just really confused because it genuinely, like, I would have bet a lot of money on the fact that there was a release of something, but I guess it was just air or the tube itself, but it really felt like it was bleeding or something, but it wasn't. So if you have this done and you get that feeling, you can know that it's actually not bleeding and it just feels like it is. Around this sort of time, the meds that they've given you in surgery will be wearing off, if not completely out of your system, and so you may start to find some things uncomfortable. So the main ones that I found uncomfortable was looking up. I just couldn't really do it because it would stretch the skin too much, and also they put a dressing over that drain hole, and the dressing made any movement of my neck really uncomfortable. I really thought that it was pain from the surgery again, but actually as soon as that dressing came off, all of that discomfort went away. So if you're dealing with discomfort in the first couple of days after surgery and you have a dressing on that drain site, that could be causing it, and taking it off could actually improve that a lot. It only actually has to stay on for about 24 hours and then the little site is healed enough. And to be clear, I'm talking about the drain site. The incision site is the one that stays numb, and then the drain site can be a little bit more problematic. For the first couple of nights sleeping at home, and especially if you have a dressing on the drain site, I would recommend a V-shaped orthopedic pillow, just because getting into and getting out of bed can be quite difficult. For me, it was that dressing like really restricted my movement and really made it uncomfortable. And so until that was off, I found the V-shaped pillow really helpful. I didn't really need it when I was in bed to go to sleep, but it did help me. Like, lying down was just really uncomfortable, and then sitting up was really uncomfortable too. So I would be fine all throughout the day, and I would be fine once I had lied down. It was literally just 5 seconds where you'd be like leaning your head back and you would feel that, and then getting up again you would feel that discomfort. But hopefully if you're able to get that drain dressing off, that shouldn't last long, or even if you don't have that dressing, it should only last a couple days. I think for me it lasted 2 nights, so it really wasn't too bad. And like I say, it wasn't the whole night long, it was just those 5 seconds where you would lie down and the 5 seconds when you would sit back up in the morning. And then over the next couple of days, you may start to get some itchiness. Mine was really extreme, and I remember desperately trying to not itch the actual site itself. And luckily that did get better over time. It's still there now, so this is my longest running symptom. It's still quite itchy, but it's definitely decreased, and hopefully soon it will go away for good. I'm not sure if it will, but I'm expecting it to. I know that these things don't heal overnight, and it's not that the itchiness is bothersome or anything, it's just if I'm out in public, I notice when I'm doing it. So then for me, weeks 2 and 3 were just nothing. I didn't have any other symptoms other than the itchiness. And then in week 4, I suddenly got some very low level pain. This pain was only a 2 or a 3 out of 10, but it was unexpected for me. I didn't know this was going to happen. And basically it was just my body healing, and specifically the nerves healing. And so that did cause me some discomfort for a couple of days, but it was never too bad. And the good thing was that it brought my sensation back. I'm feeling unwell again. If you're watching this video, this is nothing to do with the thyroid surgery. I've got other conditions that make me unwell, so I'm just checking to see how I'm doing. My heart rate is going down, thankfully, but it had shot up to, I think, wow, did you see how quick that went down? When I clicked this on, my heart rate was at like 140, and now it's gone right back down to 85. So hopefully I can carry on. Sorry about that. So yeah, a few weeks in, you may have a little bit of discomfort or mild pain where your nerves are healing, and that's all a good thing. It means that your sensation is coming back and restoring to how it used to be. it just is uncomfortable for a couple of days. For me, I had 3 days of discomfort, and then gradually I noticed the sensation in my neck coming back. I was really pleased about that because the lack of sensation was just so odd. You'd be feeling your neck and the numbness would make it feel like your skin was a different texture. Like it would feel plasticky and thick there, and I just didn't like how that felt. So when my sensation came back, I was really pleased about that. From this point onwards, if not slightly before, I was also massaging the scar to help that scar break down. In the beginning, it's really lumpy, and I don't know if that's scar tissue or dissolvable stitches, but if yours is the same, you don't need to worry about it because it does go down. So mine now feels very, very flat, and I wasn't even on the ball with massaging it. So if yours is lumpy, you can massage it to help that go away, but it should get better on its own anyway. Then at around 6 weeks, you will probably have a blood test. If you're on medication, this will just test to see that it's working okay. And if you're not on medication, it can assess whether you need to start it. And that's it. Other things you can do to look after your scar is massaging the area. That will help some of the scar tissue break down and give you a much flatter and smoother scar. You can use a healing cream if you want to, although that really is optional. And then the main thing you can do is protect it from sun damage. So you can use things like scarves or sun cream. Is my heart rate jumping again? It feels like it is. It's on its way back up, for goodness sake. Or down, I can't really tell. No, down. So I missed the high and now it's coming down. Gosh, I don't know what that's about. My heart rate normally steadily increases when I do these videos, but during this video, it's been like suddenly spiking and making me feel like I'm gonna faint. And then just as quickly as it came, getting better. And we're now down to 88. That's so weird. So I hope this helps. I wish you the best of luck with your surgery. Let me know if you have any questions, and I'll see you in the next video. Bye.